Hello, everybody, and welcome back to the Patients First podcast. I'm your host, Dr. Bryan Laskin, and I am always excited that you're here, and I'm super excited that we have an amazing guest today with us on the Patient First podcast, Dr. Kalpesh Patel, who founded Active Dental in 2009. Coming from a family with a strong business background in hotels, he always knew he wanted to be in business. Driven by a commitment to hands-on patient care, he has learned that putting patients first, similar, means putting teams first, recognizing their crucial role in patient well-being. Dr. Patel's strategic focus on de novos has propelled Active Dental to remarkable success, with the practice currently thriving across 4 locations and growing. Dr. Patel, thank you so much for being on the podcast.
Brian, thank you for having me. It's an honor to be on here.
Well, so we talked about a little before. There's a couple things just in your bio alone that I'd love to unpack with you.
Yeah.
So number one, this is the patient first podcast, and you said putting patients first by putting your team first, right? Now,
Yes, sir.
I don't think you can do both. So explain to me what you mean by that.
I've done dentistry for a very long time. And, when you're young and you're naive, you're going to come out and you're going to save the world one tooth at a time. And you're going to take these patients and you care about them. And a lot of my patients are, I've been around, but they're a lot of family. You're Indian, you're connected. People see Patel, they want to come see the Patel doctor because Patel thinks Patel, right? And you're building this. I'm building this network of patients, we have a lot of other patients too, and we're building this and we care about the patient and I want to do everything for them. As we started growing, we sort of came to an inflection point of I can't take care of everybody. And instead of seeing one patient at a time, now I'm like having my assistant, hey, can you do this part for me? And I'll come back in and finish this. So the end package I'm responsible for. The in between, I trust my team to do. And as we started growing beyond that, I realized, hey, I don't I've done this for a while. I don't really enjoy the physical act of dentistry anymore as much as I used to. How do I take care of these patients? And so I started getting team members, started hiring associates, training them, coaching them, and getting them to sort of see the same things I do. And I've come to this realization, and I can clearly say this is I don't care about the patient as much. Okay. And I do care about them, but I realize if I put that time and energy not in my patient, but in my team, coach them, train them, develop them for what they need to do, and hire the right people with the right core values that align with active dental, they will take care of the patient and they will put the patient first. So it's almost a trickle down effect.
I I totally agree, and the way that I also think about it is that the the practice, your business has to be focused on the patient's perspective, right?
Yes.
And that's and I think as an industry, we have gotten away from putting patients first. And that's I think, but you're exactly right. The way to implement it is definitely through your team members. I appreciate. I kind of gave you a question, which was a little bit of a trick question because we're in alignment, but I appreciate how you unpack that. I
Yeah, I
totally.
mean, we've gone through our ebbs and flows where we've had to remind our team, hey, even though we're focused in on the business side, we're doing this for a reason, and the reason is to take care of the patients. And so we've had to come back and, I'm back in the chair right now, practicing in my office specifically for that reason, to realign those core values and to say, hey, our patient is first, and doing that. So it's been a journey for sure.
And I mean, I don't know if you agree with me, but I firmly believe that for a dental practice to grow, the best way to grow is by focusing on patient's perspective and delivering dentistry from the way that the patient wants it to be delivered. Would you agree?
Abs- Absolutely. I mean, look, they're the drivers of this, right? I can say exactly what they want, or I can say exactly what they need. Sorry, doesn't mean that's what they want, right? And they come in and they see with a different pair of eyes. So it's a good exercise to do, and we've done it multiple times. Is to actually go sit in the lobby, right, and then walk your way through the office as a patient. What do you see? We're so busy setting up the room perfectly fine that sometimes there's a little bit of trash on the floor that we didn't pick up and clean up. And the patient recognizes that, right? And everything is from the eyes of that patient. I think it definitely directs, the success of your practice.
I could totally agree. One of the things that we did in my practice every year was we would hire somebody like a friend of a hygienist or somebody
Uh,
who had nothing to do with the office other than they knew somebody there, give them a clipboard and a piece of paper and say, write everything that you see that you'd like to have fixed. Try not to edit it at all because you're going to hurt our feelings, right? And so you actually pay them to do that. And it's funny because they'll write down that piece of wallpaper that's like peeling back or something.
yeah,
These simple things that you because you go there every day, it just becomes part of the fixture of
it
the
just becomes a
of,
normal.
right.
Yeah,
Yeah, yeah,
yeah.
it's a great tip. Well, the other piece in your bio that I'd like to talk about is de novos because I kind of grew my practices through acquiring existing practices, and I've always had this idea that de novos are it's more challenging because you're not buying like revenue day one. However, you're not also buying somebody else's problems. You can kind of start with a blank slate and then kind of create your own problems, maybe.
Yes,
Uh,
I
uh,
think you hit it on
so
the
I
nail
just
right there.
I'd love to have like, could you expand on your experience of growing a group through de novo?
Yeah, so we when I got out of school, I had a couple jobs. I worked at one where they wanted me to actually purchase the practice, and we looked at it, and then we started looking at different avenues of purchase. I just couldn't find the right one for me. Different scenarios, different procedures, different locations, all of that. So we started our own. A lot of learning lessons, a lot of growth in that part of it. And as we learned, we started building sort of a model that we like to practice. And then our model that we like to practice, what we recognized is we can go and acquire practices. However, we have to turn that practice that we acquire and flip it into our model. And that becomes real challenging. We're going to have a big turnover in staff, anyways. We're going to have a turnover in some patients because we're changing the way that we did things. And so, like you said, you inherit their problems, and then I'm implementing my new stuff, which this practice isn't used to. They're not going to like it anyway. So we figured out that starting brand new with a clean slate, we get to develop it. The coolest thing is I'm a tech geek and a nerd, and so we don't have all this old equipment. Everything in there is brand new, right? It's really good for recruitment purposes, for our staff purposes, for our doctors. They get brand new equipment that's not going to break down all the time. We get new technology that we're able to do instead of sort of patchwork inside of the practice. So it's been beneficial on the de novo side. Definitely still working on tweaking our model and refining it all the time to come up with an ideal one. So that's what we're working on right now.
Well, that's great. You're obviously speaking my language when you're talking tech geek and nerd and putting in the best technology. So where do if you could compare, one of your practices to like a active dental practice compared to an average dental practice that's not an active dental practice, where would you say, boy, they're missing the boat here. There's some opportunities to grow in the average dental practice that you guys maybe are taking advantage of that most aren't.
Yeah, the easiest thing is its availability. We have Saturdays, we have evening appointments available. If you really look at it, that's it. I mean, if you go to any city, you look in the market, and you have all these dentists, and most of them think they're competitors, and really, there's no competition in dentistry. I think you and I were talking about it. 50% of the market, 50% of the U.S. population does not see a dentist. There is no competition there. There's plenty of room for everybody. However, if you were looking at it as a competition, then you go look at everybody's hours. And then you look who's open on Saturdays, and all of a sudden, out of the 100 dental offices in that area, there's only like 10. So now you're only fighting with those 10. So the availability has been a big benefit for us. That sets us apart, right? And then it's just piggybacking that with our customer service, with our technology, and adding in all that. But I think availability is one of the number one areas that people are lacking.
Well, I always say that there's the top three things you can do to grow your practice is to focus on three things: convenience, convenience, and convenience. Right. And I think you're doing that with your availability, right? I mean,
Yeah,
and I think that it's such an opportunity. And I love the fact that you coupled that with saying how 50% of the population don't see a dentist regularly, and that other dentists aren't really the competition. I don't feel. I think it's
no,
the convenience that people see when they go to Starbucks versus when they come to your dental practice, right? The big thing that I've been thinking about after talking with one of the leaders, Dr. Maria Kunstadter from IntelliDentist, is how one third of dental emergencies end up in an ER. And you think that maybe it's from those 50% of patients that don't see a dentist regularly. But a lot of dentists, if they're off hours on their voicemail, say, if you have a dental emergency, contact 911. Well, where's the
Yes,
patient going to go? Right. I mean, you're actually the location. If somebody gets that at 6 o'clock at night or on Saturday, they're not going to call 911. They're going to call active dental. Right.
that's right. It's very helpful to get that. So those are just a very easy, simple way to gain new patients and then to be able to take care of people. And then those patients end up referring others and they end up coming back in.
Well, that's so. Where do you see? We were talking a little bit before about where the industry is going. Where do you see as one of the leaders? I would say in a progressive group that is focused on putting patients first, convenience and accessibility. How do you think that this is going to? Because I think that we're in a rapid state of change right now in dentistry,
I
and
agree.
and and I think that the things that we're talking about that you'll probably bring up are going to be here before people know it. So, where do you see the next phase of dentistry? Where do you see us headed?
I've been looking at this for a while, and it's part of my journey of growth and why we're looking to expand is dentistry is going to get sort of capitalized a little bit. It's happened in the medical world, it's happened in the pharmaceutical world. There were independent pharmacists for a very, very long time, and you would go to Joe's pharmacy down the street, and Joe's doesn't exist anymore. And if it does, it is a very specialized niche market where they're doing compounding, right? It's CVS, Walgreens, Walmart. My wife used to work for Target Pharmacy, and guess what? CVS bought Target Pharmacy. They're big enough to do that. I don't know that it's fully going to get commercialized in dentistry just to that degree, but that is where I see it heading because the the patients, the new generation, they want convenience. They want to be able to get in and out on their phone. They want to spend their time not in the dentistry aspect, not in the dental office. They want to spend their time elsewhere. And that's really where I see it going. And it's going to be, we can fight it and we can say, no, we're going to be this, private practice and we're going to be that. And there's going to be a niche market for that for sure. Or you can start giving the patient what they want.
Yeah, what I really applaud you for is that you're a group that recognizes this, led by dentists who understand the clinical side, right? And I believe that one of the gaps that we have in this next phase of dentistry is not enough clinician leadership. I mean, we when I met you at a meeting, we were one of the only few dentists at
There's
the
only three
meeting,
of us, I
right?
think. Yeah, I think there's only
And
three of us.
yeah, and I think that there's great leaders who aren't dentists, right? But but the industry we're in requires much more clinician input than I think is currently being presented. Personally, would you agree with that?
I fully agree. I think there's certain businesses coming into dentistry, and they're running it and operating like a business. And then when you do that, it goes back to what we talked about in the very beginning: is we're forgetting that there's a patient in front of us, and there's a face in front of you that you need to talk to. We get so numbers oriented and so just moving things along that there is an actual human being in front of you that we need to understand and take care of and treat. And we work for them, right? It's not they're our patients and they'll do what we say. We work for them and we need to find a way to deliver for them what they need. And I think clinicians are the ones that have that hospitality, that care, that compassion. That's why we went to school to serve patients, right? It's a service that we're providing and that means you're serving patients and we have to remember to do that. Sometimes you bring in the business side of people and it definitely loses touch of that.
Well, and I know that giving back is a big theme of yours too. So could you talk a little bit about active dental and yourself? What that means to you, giving back?
Yeah, for me, giving back is this sort of next phase of my journey. How do I give back? We've been blessed to grow a practice, been blessed to take care of the patients I have. Now, how do I give that back? And really, the way it is to expand upon it, giving back more dentistry to the patients that we need. And how do we do that? Is I give back to my team. It's something that we talked about. We're a smaller DSO, sort of, and along my journey, the people that I've always looked up to, they were miles and miles ahead of me. I hasn't found a person that's sort of in that small incremental person that can has the same problems. I don't have the same problems in my company that Decadental does, right? They have very different problems, but at one point in time they did. And so if I can give back in that community just to dentists, just to coaches, just to our team members and help them grow in a small area, that's kind of what we're looking at giving back.
Oh, that's great. Well, so where can people go to find out more about Active Dental and yourself?
Yeah, so our website, activedental.dfw.com, that's Dallas Fort Worth. We're growing in that market, and that's really our website where people can go. And then they can always reach out. Our information's on there. They can always reach out, and I'll be happy to share and guide anybody in that avenue.
Well, thank you very much for that. And thank you for being on the podcast. It's been great. This short conversation has been very enlightening to me. And so I think for everybody else too.
Yes, I think so too, Brian. Thank you for having us.
Yep. Take care.
All right, thanks.